Hello, everyone, and thank you for joining us today. We're truly delighted to have the opportunity to discuss with such a specialized audience about our recent research work, which was an independent evaluation of services for adults with a learning disability and autistic adults in prisons in the Midlands that was commissioned by NHS England. I am Niko, the director of the Autism Research Innovation Centre at the College of Health and Science of the University of Lincoln. Generally speaking, our research work is focused on enhancing the lives of the neurodivergent community and those who support them by providing empirical evidence to inform the provision of educational, employment, and health services for them. A core aspect of our work is that we use participatory action research, meaning that we involve all key stakeholders, for example, service users, commissioners, professionals like yourselves, in all aspects of the research process. And we hope our presentation to spark an interest in collaboration. Furthermore, depending on the nature of the project, we form interdisciplinary academic teams with complementary expertise to facilitate this process. Rachel and Lauren are two of the core members of our academic team that practically led this work. Lauren, Rachel, would you like to introduce yourselves? Maybe.
You go ahead, Rachel.
Hi, I'm Rachel. I'm a senior lecturer in the School of Health and Social Care. I've previously worked in prisons doing offender behaviour programmes, and I've worked with young people in supported housing projects following that. So I'll hand over to Lauren.
Thank you. And I'm Lauren Smith. I am a senior lecturer in the School of Psychology, but work very closely both with Niko and Rachel. My background is I used to work in prisons, predominantly in resettlement services. And so, yeah, just really pleased to be here to share with you what we've found.
Fantastic. Can I have the next slide, please? So although I know I'm speaking to specialized audience, I would like first to go over the terminology we use in this evaluation to describe people on the autism spectrum and people with learning disabilities before briefly explaining the scope of this work. The terms we used were adopted by NHS England, and these were based on evidence suggesting that although there is no single way of describing autism that is universally accepted by the UK's autism community, identity-first language seems to be preferred by the majority of autistic people. And we use person-first and disability language to describe individuals with learning disabilities. It is worth noting that other neurodiverse conditions, including learning difficulties, were outside the scope of our research, but as you would expect, many of our participants reported comorbidities such as ADHD, and many of those were not sure about the diagnosis they were given. Now, when it comes to the background, why this research is important, in short, it seems that the prevalence rates of autistic people and people with learning disabilities are much higher compared to the ones we see in the general population. To tell you the truth, every time I see these numbers, I don't know about you, my mind goes blank. How is this possible? I think the answer to this will be very complex, but it would probably start by changing things in the community, because it is known that although this group of people should be able to obtain the same health services as anyone else with similar needs and should expect similar outcomes, that doesn't seem to be the case. In fact, autistic people and people with learning disabilities are more likely to access healthcare services, and this tends to have a negative impact on their health. Sorry. And of course, you would expect that based on these numbers, in prison settings, we should expect a significantly higher demand for health services coupled with limited available support. So our government knows all about this. And as a response to this, NHS has prioritized. Lauren, can I have the next slide, please? Thank you very much. To reduce health inequalities for autistic people and people with learning disability, not just in the community, but also in prison settings. And in an attempt to inform their actions, NHS England commissioned our team to conduct this evaluation, which we are going to present to you in good detail. Now, apologies, can I have the next slide, please? Very briefly, I would like to outline the stages that we follow in this evaluation. We had two core parts. First, we ran a rapid review of existing evidence to see what is known, and we use this information to inform the design of our studies. And then we started collecting data, and we use different forms of data collection, including surveys, one-to-one interviews, focus groups, both with prisoners and professionals, that is prison staff and health professionals working in prisons. And it's worth pointing out that all the research materials were developed in collaboration with our steering group, which consisted of professionals supporting autistic people and people with learning disabilities, as well as service users. I will very briefly like to show you the main findings of our rapid review. It's worth pointing out that we review both grey and academic literature. And I'm not going to go in great detail in this, because these findings were also reflected in the evaluation, which we are going to present you in good detail also later on in the following video. But what I would like to say that the key findings indicate a lack of clear prevalence data, routine screening and assessment, staff training opportunities that frequently had a negative impact on their confidence supporting this group of people. It seems that there were limited opportunities for reasonable adjustments, documented care pathways or information on their effectiveness. Some specialist staff seems to exist here and there. This picture was also quite patchy, but medication continuity seems to be lacking. So taken together, I think it will be best to show you the video now, which we're going to cover all of this stuff.
Sorry, Niko, the slides are jumping around because I think there's some automatic
apologies, yes. And maybe a couple of more points I would like to point out here is that we found limited evidence about equitable access to services. So this is unconfirmed. And many reports emphasize the need for joint care planning, information sharing, and lived experience support. That's it. We can move to the next slide, which is the video. And Lauren, if you like, you can play it. I think
I'm not getting any sound.
Prisoners are actually overrepresented within the prison population.
Did the sound come on?
It did as you were going. Yeah, it did.
Right. Let me just go back. Bear with us, everyone. We'll try again.
Reliably estimating autism and learning disability prevalence in prisons is essential for making judicious allocation of resources. In this review, we found that prisoners with learning disabilities and autistic prisoners are actually overrepresented within the prison population.
This review came off the back of the NHS report into meeting the needs of autistic adults and people with learning disabilities in prisons, and they commissioned us specifically to review what was happening Midlands.
The Autism Research Innovation Centre at the University of Lincoln conducted this review in 24 of the 26 prisons in the Midlands. 93 prisoners, 175 prison staff, and 16 staff from pre- and post-prison services took part via a range of methodologies, including data reporting, questionnaires, focus groups, and interviews.
The aims of our review were to conduct an independent evaluation to find out what is happening in practice to support people who are autistic or with learning disabilities.
We had 15 different questions to answer that were set to us by the NHS. We needed to identify areas of good practice within services and also what was missing.
We really felt for this evaluation that we needed to speak to the people with lived experience to find out how it was being received, because what you can find is that the staff members will tell you what's happening, what the policies say, what the services are, but sometimes it might not be experienced in the way that is intended.
We use a holistic approach by asking both staff and prisoners about their needs and perceptions of what works well, what doesn't work well, what can be done to improve.
Of the 24 prisons involved in the research, 15 were visited in order to get a clearer picture of the lived experiences of prisoners.
Whilst we saw examples of good practices with specific prisons, at the same time, it was clear that these were not present across all prisons. We made recommendations based on what prisoners and staff told us in an attempt to create a model that can be implemented universally.
The ARIC report makes a number of recommendations for each of the 15 questions the review set to answer. These can be summarised under the themes of care pathways, training, information sharing, and resources. The review highlighted the need for consistent screening and assessment for prisoners as soon after entry to prison as possible, a clear support plan tailored to their specific needs, and the provision of reasonable adjustments where appropriate.
Screening is so vital because it allows people to then access the support. What's needed is the guidance around when it should be done, what tools should be used, and how that information is then used to help that person and to follow them through as well the system. We saw loads of issues with this, people saying that it's just not accessible, and they were being told to wait until they left prison to get the screening and assessment done in the community.
So we spoke to a number of prisoners who did have a diagnosis. They told us that although they'd found the assessment quite difficult, actually it helped them to make sense of themselves, but then they didn't really understand what that meant for them. And it hadn't really changed the support that they were receiving.
There needs to be formal support in place that can then be documented on a care pathway.
Training was a key theme throughout the results of the staff survey. Prison staff reported a lack of confidence, knowledge and understanding required to best support autistic prisoners and prisoners with a learning disability.
Consistently throughout the study, what the staff were saying, needing more training, more systems, more knowledge, was in line with what the prisoners were saying. I need people to help me more. I need people to be seeing me in this way better.
It seems that most people did not have the opportunity to actually gain some formal training for autism and learning disability. And we heard many examples of people self-learning or by referring to their own lived experiences.
So whether it was a family member who was autistic or had learning disabilities, they seemed to be able to relate more to the prisoners, which meant that they were able to tailor their communication or to support them and work with them in a different way that really suited their needs.
Information sharing is key to providing continuity of care. As someone enters into the justice system, it is vital that any information that is related to their past experiences, medical history, or any diagnoses they may have travels with them into prison, as well as between prisons and healthcare providers, ensuring that they receive the support required. This is a challenge due to confidentiality legislation. However, information sharing is possible within a prison context.
We found evidence of good and bad practices, and we can use good practices to create a model that could be used across all prisons.
To give an example of when information sharing didn't happen, a person that we spoke to said that every time he went to a different prison, he got given a different diagnosis. And he said, it makes me feel like 3 different people. In another example, we spoke to somebody who had been in receipt of counselling before he came in prison. But when he arrived in prison, nobody would speak to the counsellor, nobody would gather the information about what he needed. And he felt like that was a huge gap in terms of the prison being able to best support him.
All the recommendations are underpinned by a lack of resources to deliver the support needed. This could include anything from necessary finances, access to screening tools, and training or equipment to provide reasonable adjustments, such as easy read overlays for documents and items to address light and sound sensitivities.
And we saw that in staff responses. They were telling us that they wanted to do work, that they were coming up with local initiatives to help manage the need of their particular population. But they were really struggling because they didn't have the resources to do that.
It's really about shaping up good practice. If you do this, people are less likely to get in trouble in the future, less likely to reoffend, less likely to cause harm in the future. That ultimately is the best interest of the system. So it is a win-win, but it does require an investment in the first instance.
Despite the issue of the need to improve services being much bigger than anticipated, we did hear some stories of good practice, positive outcomes, and successes.
A good example was from somebody who'd come in who had not got a diagnosis but had had issues with their behaviours. When he came into prison, he was able to get the screening for autism. And he described this as being quite a positive process for him, not just because of the screening being done, but because of the support that was put in place around that. People were able to consider what his needs were, and this was taken into account, which meant that there was less confrontation then. So it enabled him to work through his behaviours, and he feels that that has been a really positive experience for him.
The conversations that we had highlighted a real willingness and eagerness to improve the awareness, understanding and support available.
Not only was there a will, but also it was consistent across all the members of staff. So whether or not you worked for the public sector or private sector or health services or prison service, everybody saw the problems the same way. Everybody saw their solutions the same way.
I believe that commissioners are very keen to drive change. I hope that the information we provided will help them guide the implementation of changes.
We've been able to access such a wide range of data from such big numbers of people. That in itself is probably one of the biggest pieces of work within this particular area that has taken place. This provides a real opportunity to be able to use what we found and to be able to make these recommendations that leads to better outcomes for autistic people in prison and people with learning disabilities in prison. So I think it's over to me for the next bit. We hope you enjoyed the video and found it useful. Hopefully that just gives a real overview and a summary of what we did, how we did it, and some of the key findings and the recommendations that we made from there. So we wanted to just spend a little bit of time following the video, just digging a little bit deeper into some of the areas that came up within the work that we did, specifically within the prison visits. And from the conversations that we had with people in prison, we were able to develop a series of case studies to draw out some good practice, but also some learning points as well. And so the first case study that we want to talk about is the case study of Hayden. And I should say that names have been changed for all of these case studies. So Hayden is somebody that I referred to in the video, actually. So he had been given a diagnosis a few years before he came into prison. And one of the first things that he told us was how difficult that assessment process was. So although his assessment happened pre-prison, I think there's some stuff to carry through into prison here. And obviously it's important when we're working in prisons to think about what's come before and also what comes after. So he talked about some of the difficulties he had with the questions and also some of the realizations that he had. So when he was asked to make up a story, for example, he really struggled with that. And that for him was quite an emotional process to go through. However, at the same time, once he'd been given the diagnosis, he felt like it was a weight off his shoulders because he finally understood some of the experiences that he was having. As we mentioned in the video, so it was Hayden who was talking about he had a counsellor before prison and there wasn't that continuity of care in terms of somebody having those conversations with the counsellor to find out more about the work that had already been done and the things that would be most suitable in terms of helping him. And he wasn't able to carry on any of those conversations either. From what we could establish, there weren't any restrictions in place that would have prohibited that from happening. It just didn't happen. Hayden was also kind of described and viewed as a kind of model prisoner. You know, he got up and went to work every day. He kept his head down, and as a result of that, he felt like people didn't really understand that actually there were things that he did need help with. And so one of his messages was, you know, just because we may come across as model prisoners at times doesn't mean we don't need support. And so it's important to look out for that as well. He also talked about a real important moment for him in terms of when he was engaging in offending behaviour programmes, and talked about the difficulties there because of the intense emotions that he often felt. And he felt that engaging in programmes sort of tended to open the floodgates for him. And actually that could have a real long-term impact on him. And he particularly talked about victim awareness and victim empathy and victim perspective taking exercises that he'd been asked to do, because he was being asked to put himself in their shoes. And as a result of his autism, that was something that he specifically struggled with. He couldn't put himself in somebody else's shoes. He couldn't look at it from different perspectives. And so that was something that he really highlighted. And he talked about a need to ask the right questions. So he gave us an example that when he was feeling low, he would often phone his wife for support. And at times she would be quite worried about him because of the things that he was saying on the phone calls. So she would put a call into the prison to the Safer Custody helpline to say, I'm worried about him. Somebody would then go and see him to kind of say, how are you? But that might be a couple of hours after the phone call. And in that moment, if somebody said to him, how are you? He would say, yeah, I'm okay. Because by that point, he had kind of leveled out a little bit and was feeling better. What he said he really needed to have asked was the specific question of, how were you 2 hours ago? How were you during that phone call? What was going on for you then? So he talked about this real need to ask the right questions, create safe conditions, and also to consider intense interest, because that can help people in terms of allocation for work. So there's some key points from this in terms of continuity of care, the difficulties in terms of experience in the assessment process, the fact that people may well present themselves as kind of model prisoners, not really coming to the attention of staff, but that doesn't mean that they don't need support. Some of the specific challenges around programmes and interventions, and the importance of having conversations with people about how they experience programmes and the impact that that might have. And then asking those specific and direct questions as well, and just looking at people's individual needs and interests. So he talked about his intense interest was around mending things, specifically computers. Now, he wasn't able to mend computers in prison, but he was able to get involved in real practical jobs where he was mending other things. And so that was a real match between what his intense interests were and the work that he was undertaking, which really suited him. And I should have said before we started these case studies, we're probably, in the interest of time, not going to pause in between each one, but obviously feel free to put observations, questions, suggestions and so on in the chat as well. And I'll hand over to Rachel, who's going to talk about the next case study.
Thank you. So the next case study is about someone we spoke to called Phil. And I also referred to Phil during the video in terms of he received his autism diagnosis whilst in prison. And he, in our interview, he kept on talking about his awareness of his behaviours beforehand, in the sense that he really reflected on how he had been before he came to prison, and all his life really as he was growing up, that he'd really got a lack of awareness of social cues, and he really just didn't understand other people and what was going on in those relationships. And due to that, it had resulted in a lot of conflict as he was growing up as a younger person, and then also in conflict as he came into the prison environment as well. And you can see that he's saying that he just didn't understand jokes, and for him this led to a lot of paranoia and feeling like there was something wrong, and in particular with him. So that would then result in violence for him. So when he came into prison, someone said to him, how about we look at this diagnosis for you? And he was really, really anxious about this, because at the start he thought, well, what the hell's wrong with me? And he hadn't really got a really good understanding of what autism meant. And as it says in his quote, he really genuinely thought that it meant he'd got a disease. It's something that he'd caught, and something that, you know, he needed to sort of sort out and get treatment for. However, regardless of that being a daunting process, what he found was that it was really, really supportive, because in that particular prison, they'd got a really good initiative in place where if they were doing the screening and assessment, it didn't just finish there. They didn't just do the assessment and leave them to be, or send them off with a leaflet or anything like that. This particular process they got in place meant that he was given more information, but in a variety of different ways. So he speaks about being able to access videos, and this being really helpful for him to kind of be able to understand what autism meant and what his diagnosis meant. He also spoke about being able to have some time to go over the information and allow him to process that. And as we saw here, this helped him reduce his anxiety and the potential behavioural consequences as a result of that. He felt really agitated after his assessment. He said the thing that really helped him with that is the fact that what the healthcare team did there was they promised to do something, and they carried that promise through. And he spoke about the importance of that as well, in terms of sticking to what was being said. And ultimately, this improved his interactions with other people. It meant that he understood himself more and he could explain what was going on. And this has really improved his relationships, both inside of prison and outside with his family. So the key points that we were taking away from this, because it was a really positive example of things that had that were happening in that particular prison, was that the information that he was given following that assessment was really key for him to be able to process that and to have a positive experience. So we said that was a really good thing to highlight, as well as that idea of providing support in a different ways. So not just giving somebody a leaflet, but thinking about the manner of the way that we give information. And the fact that an assessment actually may help people understand themselves more. For you know, not for everyone, but for some people, they really see that as a positive thing, to be able to understand what's going on for them. I'll hand back, I think, to Lauren for the third case study.
Thank you. So yeah, this next case study is about a lady called Faye, and she had already received her autism diagnosis and also experienced poor mental health prior to prison. And this was one of the first things that she told us about, was how difficult it had been to get support before prison, despite multiple presentations in A&E and to other organisations, but nobody had kind of joined the dots, and she really felt that had she was taking responsibility for her offences and not trying to sort of push responsibility elsewhere, but she had felt that kind of lack of joined up support, lack of coordinated information sharing had contributed towards her offending ultimately. And then she was very keen to talk about some of the challenges that she'd experienced around sort of meetings and assessments that take place within prison. And a lot of the things she spoke about applied to things like psychiatric assessments, transfer reports, OMU reports, but also potentially they could be applied to things like parole boards, programmes assessments. Oh, bear with me, let me just go backwards. Yeah, programmes assessments, and things like risk assessment interviews as well. So first of all, she talked about the difficulties of having the meetings over the phone as opposed to face to face, and or on Teams, even over kind of video link. It was particularly difficult because she just couldn't. She didn't have any cues in terms of body language, and there just wasn't that kind of openness within the communication that she particularly struggled with. She also talked about not being prepared for meetings. So somebody would literally come and get her from her cell and say, you've got X meeting right now, which she felt that she really needed to be able to sort of mentally prepare for those meetings. And experiences like that didn't give her those opportunities to be able to mentally prepare. She also talked about difficulties in terms of sometimes the way the questions were asked, in the fact that quite a lot of the questions, there wouldn't be any specific context given about why the question was being asked, and sometimes she didn't actually even fully understand the reason for the meeting, so there weren't any kind of intended outcomes given to her in advance. There was no reasoning behind the questions and the context of the questions that she was being asked to answer. And whilst some people might be able to kind of fill in that context and deduce the reasons for asking, she wasn't able to do that. And so it made answering those questions and that whole experience of being asked those questions quite stressful and distressing for her. And then she also went on to talk about her feelings and experiences after some of these meetings. So she said often, you know, when she'd been in a fairly critical meeting, she would kind of replay the whole thing in her mind, thinking, what could have been different? What should I have said? What was going on there? Why was that question being asked? And that in itself was quite distressing for her. And so she suggested that actually, if those types of meetings are happening, there might be the opportunity for a debrief, and that would be really positive and helpful, just to clarify information and understanding, to know what the outcomes were, and to know what happens next. But she felt it should be done in a different room, so moving from the environment where the questions had been asked, but it should be done straight away. So the key points from this, obviously there was the kind of lack of support prior to prison, and like we said, we put that in terms of the broader context. But the main points that she raised were about some learning in terms of preparing people for assessments and also giving those additional explanations during meetings to just help people through them. So the specific suggestions that she came up with was that clear upfront communication about what the intended purpose of the meeting was and what that meant for the person who was being invited to the meeting and to answer the questions. Just what to expect and when, so people could mentally prepare. Face-to-face meetings rather than over the phone to give those extra communication cues. Asking of direct questions, so direct questions that weren't open to misinterpretation, certainly not more than one question being asked at once, and giving that context as to why the questions were there. Also talking about the kind of sources of information. So the reason she put about this was because sometimes somebody would say, I've seen this information about you, or I've heard this information about you, and I want to ask you a question about it. But they didn't tell her where the information had come from. Now we know in prison sometimes that's not possible, but actually if it's something that's come from, I don't know, from notes about the court case or from a particular report that's been written about them, that sort of information could be shared. And she talked about just the basics of just open, friendly and decent communication. And she did suggest whether there could be something kind of akin to what happens in police stations with appropriate adult schemes, where there's somebody there to just make sure the process is followed and to support people. And I think, you know, certainly people were kind of saying that's a fair point, because actually in police stations there is an insistence on appropriate adults, and then as soon as we go into prisons we don't kind of have really anything the same as that. And then lastly, she obviously talked about opportunities for reflection and debriefing, and just that opportunity to kind of come down from some of those stressful meetings as well. So I'll hand back to Rachel.
So although we had sort of times when it didn't work, there was some, again, conversations that we had with people where they were telling us what did work really well for them. And Finn and Jay were a really interesting group that we had in. And whilst they were talking and going through their interview with us, you could see how much they were supporting one another to answer questions, to make disclosures. And a lot of that was just about being genuine with each other. And they spoke loads about the importance of genuine peer support, and that this allowed them to empower one another, to build trust between each other, and to really start having a look at their behaviours and what it was that was affecting them at the time. Then they spoke about two big things that had affected their experiences whilst in this particular establishment. The first was about having really good positive relationships with key members of staff, and in particular they were talking about the wing staff, and they were saying that where they lived at the moment on the particular wing they were on, they felt really safe and they felt like they got these positive relationships, mainly because staff were there and happy to listen to them, not always going to punish them, as it says, for having a bad day. They were literally accessible, so they could physically actually find stuff and go and have those conversations with them. So they felt that even just, you know, that humanistic, more communication enabled them to sort of live with what their experiences were at that time. So they didn't feel like they had to hide some of their autistic or ADHD or learning disability traits or behaviours, because they felt like the staff were willing to understand them. And the other thing they'd had access to, that both of them had been to some particular counselling sessions, and they said that this person, and it kind of alludes to what the last case study was saying in terms of when it goes wrong. In this session, they were explaining that the counsellor said to them, we're going to take this at your pace, whatever you want to talk about, however you want to do it, when you want to do it. And they said that was really reassuring for them, just knowing that they weren't on somebody's, you know, time, they weren't going to be restricted by this. And they said, instead of just saying, what's wrong with you, as you can see, they started to ask more questions in terms of like, what's unique about you, how can we use this in a positive way, how can we help any of these interests that you've got be used in a positive way to help you progress forward. And as you can see, they said because medication just doesn't do it, and they're quite critical of sort of the medications they've been through, and quite a lot of medications and misdiagnoses in the past. So the key points from listening to Finn and Jay talk to us really was that peer support can be a really positive positive experience for people who are autistic or with learning disabilities, and we'll see a bit more of that in the final case study that Lauren will do in a moment. We also sort of make that point about those relationships with the people that they're interacting with are key. We know this anyway, but that really kind of highlighted that just being more humanistic in terms of being a person, but, you know, allowing someone to come and talk to you and allowing people to have a bad day sometimes really helped build those rapport. And that linked to then feeling like they're not going to be punished all the time for their behaviours. And this came across in quite a few of the interviews that we did, is that people felt they were going to be punished for things that potentially they didn't really understand sometimes themselves. And then the last point was that formal counselling might be a really positive support system for them to work through those feelings. So the next case study that I'm going to talk to you about is one where we saw some further issues. So Victor, we spoke to, and he'd been in prison for over 20 years, and certainly on and off he spoke about being in prison for over 23 years, and that was the majority of his certainly his adult life, and it's led him to feel like he's very institutionalized. But he was reflecting on sort of his experiences, and Victor had got learning disabilities but wasn't really aware of it as such, and didn't really understand his own diagnoses. For him, they'd all kind of just like merged into one. So he spoke about the assessments that he'd been through, and for him it brings back to this concept again about assessments being traumatic, and because these assessments are asking about his childhood experiences and we're asking about things in his past, it made everything kind of come right to the forefront, like it had been as fresh as it was before. So he spoke about that and it linking to feelings of self-harm and suicidal behaviours. that then led him to say, well, if that is then the consequence of an assessment, staff don't always understand that. And especially when it came to self-harm behaviours, he felt that staff don't really have a very good understanding of why people might be doing that, and that they just get labelled as wasting people's time, or as it being a silly response to something that they've gone through. And he spoke about that and saying that, you know, that's not helpful for him in terms of understanding what function that behaviour is serving. As I mentioned, he'd had loads of different diagnoses, but the one that he was really quite angry about was the fact that he'd been diagnosed with bipolar for quite some time. And then another doctor came in and says, no, it's not bipolar, it's ADHD, and just changed the medication. And he says, that's great, because the medication actually is working better now. But he says, but I'm really angry that for however many years I've been on the wrong tablets, and it feels like somebody should take responsibility for that. And he feels like he hasn't got anywhere to go to talk about that. And all of these really have affected how he's progressed through the prison service, and really kind of is the reason why he's been in prison for well over 20 years. And he feels like he's stuck, and he says that staff have said to him that he's warehoused, and this is because of his waste score. His IQ is too low, and he's not able to access any of the courses that they're telling him he needs to access in order to progress and to get out of the security category that he's in. So he feels like he's just in a place of never going to be released, all because of his learning disability. So the kind of key points that we took away from this one was that thinking about how we can do assessments in a more trauma-informed way for a start-up, which kind of comes through from some of the other case studies as well. Thinking about the training that we give to staff around understanding self-harm. Understanding that relationships need to have an element of compassion in them in order to get a good working relationship with people. Victor also spoke about being very vulnerable in the prison. He says that people see his vulnerability, and due to that, he's been attacked. He's had several injuries as a response to that, and actually he feels quite vulnerable. And it's also then created a lot of the reactive behaviours that he knows that he's engaged in. That acknowledgement that assessment and diagnosis can actually be confusing, and some people come out of it not really knowing what's going on for them. And we saw that repetitively through quite a few of the interviews that we did. People just didn't understand what diagnosis they'd been given. And that ultimately some of these diagnoses, especially if it's learning disabilities, can prevent them from progressing, which then leads to that recommendation around being more accessible programmes on offer for people across the prison estate. So I'll hand over to Lauren for the final case study.
Thank you. Yes, this is the last one, and this isn't about it's not an individual case study. We just wanted to talk about a really positive initiative that we came across in one of the prisons. And we really saw this initiative in action because they actually allowed us into one of their groups, and that's where we did our focus groups, so it kind of did some of our data collection. So it was just seen in one prison, and it was a specific prisoner-led initiative around autism and learning disabilities. So the group was led by 2 autistic prisoners, but and this is a really important point, it was supported by a staff member from the Safer Custody team. So it was very much prisoner-led and about empowering those people to be able to do that work, but it still had that advice, guidance, and just checking that everything was as it should be from the Safer Custody team. And that member of staff was really invested in this group in terms of, you know, she was learning more along the way about how best to support people, but she also had dedicated time to be able to support the initiative as well. So the group would regularly meet to share their experiences and just to talk about who they were and to talk about their sense of identity as an autistic person or a person with a learning disability. And what we'd heard from lots of other people that we spoke to was that they would often really try and hide who they were, try and hide sort of the features of autism and some of the difficulties they experienced in relation to learning disabilities. They would mask that behaviour and really try to act normal. Whereas this seemed to be the opposite in terms of this prisoner-led initiative, in that they just felt they could be who they were and who they wanted to be, and could actually celebrate their individuality and their uniqueness. The two reps also met every new person on arrival into the prison, just to talk to them about the initiative and to establish whether they needed that support. They worked to help increase staff awareness around autism and learning disability, and they would advocate for people in prison when needed as well. So an example of that was when somebody's parole report had been written and there wasn't specific mention around autism in there. They kind of said, you know, actually maybe you could ask for that, we could help you to ask for that, and so that was looked at as well. What they would also do, though, is that they would challenge people in the group when needed. And again, we saw this in action during our discussions within our focus group. So if somebody had a perspective where actually there might be an alternative perspective, they would just gently challenge people and try and encourage people to look at their thinking when needed. So it wasn't just about always agreeing with people, it was about having that real balanced view. And the reps also were able to put forward names for, so this prison had an assisted living unit, and they were able to put forward names for people who they felt might benefit from that, so that they could then be further assessed and then looked at in terms of moving on to that unit. And when we were there, they had reams and reams of letters of people just giving positive testimonies about what this group had done in order to support them. So things like, you can see a couple of the quotes here: moving to a better wing, availability of inclusive events, not being so afraid, being able to socialise, and just being able to share those experiences and realise that people weren't on their own within the prison. They also talked about, you know, if they were having struggles, they'd be able to get together and support each other, and that it was a safe space and a friendly place for people to be able to be themselves. And they really had this outlook of, autism doesn't change me, it's not changes, I wouldn't change it, it makes me unique, so let's embrace our autism. And so there was lots of talk, as I say, about sort of really celebrating people's uniqueness and sense of identity. So the key points from this was that prisoner-led initiatives such as this one can be empowering for all involved, and empowering to staff as well, because it had raised their awareness. The groups such as this one sort of provide an opportunity and have that safe space to talk and really embrace who people were. But they do still need that staff support and that supervision, and that needs to be with and I know this is really difficult within prison staffing issues and retention issues, but a committed member of staff who had some workload time allocated to be able to support this work. And that also they could provide opportunities for those social events, the advocacy, complemented by kind of broader prison supports such as assisted living support where that's required and where it's available as well. So that's it for our case studies. I'm going to hand back to Niko, who's just going to bring us back to the recommendations just for the last few minutes, and hopefully we'll have some time for some questions as well.
Yes, I will wrap it quickly, because here we are keen to find out whether our findings, which have been themed and categorized into 4 themes, relate in some kind of way to your experiences, and how you think this could be addressed. So, for example, our themes include the need for a universal care pathway, training packages, information sharing and resources. We think that you could review, when it comes to universal care pathway, you can review your current processes for screening and assessment, care planning, as well as for making reasonable adjustments. And you can also consider alternative or even complementary methods, such as formulation. I know that formulation has been both championed and criticized, especially within psychiatrists, but we are big advocates for it. We felt that although when assessing a patient, 2 experts might produce 2 similar summaries, but 2 very different formulations, and particularly in these groups of people, it seems that there is a great need for their experiences to be heard and understood, and often they can offer interventions that could have a meaningful impact and make a difference in their everyday life. So we have a few minutes, and perhaps we can hear your thoughts and your reflections about what we presented to you today, and to what extent our findings are also relevant to the experience you see in your everyday practice. Any questions?
I'm just going to stop sharing because it might make it easier for us to see.
Yes. Well, maybe we could do a very quick survey. I was wondering if our findings relates to what you're experiencing at your service. If yes, you can stay quiet. If not, you could let us know. I see a hand up. Is that a legacy hand or someone likes to speak? Emma? Hi, Emma. Thank you. I think you're muted, by the way.
Hi. So my personal experience working within the mental health sector, then followed by the prison service and now headquarters, sort of the support and the training that you get as a staff member within an NHS setting to help develop coping mechanisms and safe practices for prisoners with learning disabilities or neurodiversity complexities is really embedded and really ingrained in your everyday working life. But moving into the prison service, and you'll have to excuse me because this is going back maybe 8 years, so things could be very, very different. That support just wasn't there. And I was very fortunate to come from a setting where my understanding was very good and I could pass that on to the staff around me. But that was very much dependent on my personal experiences and my willing to do that. It wasn't part of any training package, and it wasn't anything that was actually openly discussed either. Now, I know the prison service have some neurodiversity lead roles that have gone into every single prison, and having spoken to a couple of the staff members that have taken up those positions, it's really positive that they are energized and engaged, and they have an action plan in mind for their own establishments. But again, that's a very new post, but it doesn't cover the staff that have the majority of interactions with the prisoners, which is a concern because as a prison officer, you are the person that prisoner is in contact with. You are the person that is having to sort of adjust the way that you communicate. And if you're just not aware of how to do that or why you need to do that, it presents problems and it isolates those specific prisoners as well. So if I could go back in time and be a brand new prison officer, I would find it incredibly helpful to have some sort of additional training on neurodiversity needs, perhaps not in the initial training because it's very overwhelming, but at some point within my first year as a prison officer, I think that would have been really, really helpful.
You're on mute, Niko.
Thank you, Emma, for your contribution. Debbie, I think you have something to say.
Hi, so I am one of those NSMs that has just come into the prison, and I think it's important for people to know that one of our 5 priorities is to bring staff training and awareness up, and we're very much in track with keeping up with the prison offender managers, the mental health units, everybody, and education. So it's about completing that support plan. And absolutely, I've got folders on every wings now that one-page support plans to give prisoners that point, so that they know that the staff that are on that unit know their little idiosyncrasies. And I guess from a prison background as well, so I have been that prison officer for an awful long time. It is something that's well over needed. I think we've all known that there are things, and we are finally catching up with the fact that they're not just naughty. There is sometimes a reason behind it. So I'm sorry you visited 8 years ago, but I can tell you now things are changing very much for the better.
Well, it's great to hear that. Better late than never. Debbie, thank you. Tina, it's next, and then Liz.
Hi there. So I'm a psychologist working at HMP Wakefield, and I'm the clinical lead for our Autism unit at Wakefield. We're in a fortunate position to have such a unit. I'd echo what has been previously said about the NSMs being a new role. We've just got ours recently, and it's a fantastic partnership that we have. I think in terms of autism awareness, we're in a fortunate position where we do have kind of quarterly training that's delivered to all the staff in the establishment. It's just there available on a rolling basis. Additional training is provided as well. And for our prisoners, we have something called This Is Me sheet, which is essentially like an autism passport, I would say, although it covers other neurodiverse needs as well. If anybody from another establishment is interested in the training and wants to set that up in their prison, by all means, just drop me a line and find me on the mailing list. And it's something that we can discuss, but it really does help key workers to understand the men that they're working with better. It helps the MDT that are working with somebody, and it's something that a prisoner can take with them anywhere in the estate as well. So I think that makes a massive difference to how responsive we can be. I think all of your findings from your case studies are definitely things that we would echo, and things that we've found when we've worked with men as well, whether it's programs, risk assessments. Yeah, it's all there.
Well, thank you very much. It's good to hear that our findings echo your observations, and we very much like to keep in touch with all of you if it's possible, to see what works, what doesn't work, and to share with good practice with everyone. The next person is Liz.
Hi, apologies for my background. I'm a senior probation officer and treatment manager in the community, and working with the people with sexual offences. And what has always struck me is that the design of the programs that we have to use. We've got programs for people with learning disabilities, which are really helpful, and people in mainstream programs, but people with autism who can be quite high functioning really seem to fall in that gap. And we are obliged to do, skills practices, and sometimes in the third person, and perspective taking. All that is a big ask for somebody who's got autism. And obviously we assess people before, but we want to try to get people on the right programs, and certainly the budgets for being able to consider the environmental factors. So the rooms that we want to put people in, sometimes it's simple things like the way the blinds are set up, or the noise that is, and we've got no budget for it, and it's so frustrating. So has been a beef of mine for a long time, and I just wanted to put that out there, that it would be great if they could, with the new programs coming in, think about this group of people.
Thank you, Liz, for sharing. You're absolutely right. And actually, the making reasonable adjustments is highly important, because it could help people to feel that they're in a safe place. Otherwise, many times they might even have a meltdown, and different prisoners or even staff, they might perceive it with criminal intent in some cases, although that's not the reason.
Well, thank you. I'm going to have to go, I'm afraid, but
yes,
it's been really interesting so far.
Well, thank you for meeting with us today. Is there anyone else who would like to share their experiences or say something about our findings? If not, as Lauren posted, we will share the slides and the link to the video. And you're more than welcome to get in touch with any of us So, and to follow up today's conversation and take this further.